Okay, we're sitting here on October 30th with Katoko, who's 78 years old, and she had a cancer diagnosed in her lower abdomen in August of 2011, and the doctors essentially gave up on you. Is that correct?
Yes, this July. Yeah.
In July.
July or August. Yeah.
And what did they do for you in terms of orthodox therapy?
In October, they assumed that's all in the reproductive organs. So they had a big operation.
And did they give you chemotherapy after the operation?
Yes.
And how many rounds did you have?
Let's see. It was supposed to be. It started in December.
You had several rounds, correct?
Couple of rounds.
Okay, and it was hard on you?
Yes, very.
Okay, and then by the time you saw me, which was in August, more than 2 months ago now, you were in bad shape.
Well, after that, I had another chemotherapy in July, and I went through the same kind of reaction, and I feel that I was very close to dying experience, where everything was, I couldn't think, I couldn't feel, and just I didn't care. And at that point, I came to you.
Okay. And I would like you to stand up and go over to the door where there's better light.
All right.
And what I want to do is I want the viewer to see your abdomen. And that's called ascites. Your abdomen is massively filled up with fluid. But you can come back now, Katoko. Thank you very much. But from my perspective, looking at you, your ascites is dramatically better than when you first came to me. Now, yes, you have had the Orthodox doctors take some fluid out.
Yes, 11 times.
Yes, but it's not reaccumulating as fast now. Is that correct? And
Seems.
And your pain is less.
Yes.
And tell us about your energy and your functional capacity, which is what I'm most interested in.
Well, quality of life has drastically improved. I came to you in August, middle of August. That was the first consultation and treatment. At that point, I didn't have appetite. Hence, I did not eat. And overall, I would say I lost 30 to 40 pounds.
Even in spite of all that fluid that you're accumulating, you had lost all that weight.
Yes.
And now, how's your appetite?
Oh, changed since that August.
You're eating.
Second visit, a few days later, I think it was the lowest point. I could only eat 1 tablespoonful of food at a time. And just nothing tasted like anything, like cardboard.
I remember you telling me that. You couldn't
Yes.
stand to eat food.
No, because it was just really everything. I lost my taste.
And how about now?
Oh, I can eat almost. It was a gradual thing, but little by little, my appetite came back. Therefore, I start to eat. And as I eat, my energy level improved drastically, because on the second visit here, if you remember, I collapsed on the floor because my legs couldn't support myself.
I remember that.
And I had to be held from both sides just to get to the car. And I think that was energy-wise the lowest point.
I remember that, and I was really scared because here you were in my office and you had collapsed and you needed my assistance just to get out to the car.
That's right.
And now I can say, Kitoko, please get up and walk to the door.
Right.
Go ahead. And you're scurrying around this office, and even my staff has noticed. Come back. My staff has noticed what good shape you're in terms of your enthusiasm and energy. Now, for the viewer, may I post this on YouTube?
Pardon?
May I post this on the internet on YouTube?
Yeah, I guess so.
Okay.
Face? Maybe you take a face.
Well, it's kind of hard to take it off.
All right.
Is it yes?
Yes.
Thank you. Okay. For the viewer, I did not promise that I would cure your cancer, correct?
Correct.
And I told you it's not up to me to cure your cancer, correct?
But you improved quality of life.
I told you very possibly, in fact, likely, we could help the quality of your life by addressing what your body needs.
Right.
And I think that we've delivered that.
Oh, yes, you sure did. You
Okay.
sure did.
And I still don't know at this point where we're going in the long run. However, as an aside, just improving the quality of your life, your tumor marker, which was over 5,000, has dropped by 1/3. That's impressive, is it not?
Oh, yes. Yes.
Okay.
And I think we will have that test in a week or two.
We'll get another test in a couple of weeks and see where it's going, but you are continuing to impress me and everyone around here. So thank you for that.
Right. Wow, thank you. My goodness.
Okay. So we'll get another video on you
All right,
in a
later
few weeks. Thank you very much, Kitoko.
All right.